Welcome to Vet Surgery TV. In this series, we'll review real surgical case reports together and learn from each one. Let's get started. And if you enjoy this type of content, please don't forget to like, subscribe, and hit the bell icon so you won't miss our next videos. Case report number 5. A 7-year-old castrated male domestic short-haired cat presents for severe facial pruritus. The owners had recently adopted the cat as a stray that was found on their front porch. The cat was indoor-outdoor and frequently roamed the neighborhood unsupervised. They noticed that, for the few days prior to presentation, the cat had been shaking his head frequently and would often scratch at the neck. On physical examination, severe facial excoriation is present, along with a unilateral swelling of the left pinna. 5. You suspect the cat has an oral hematoma. What additional diagnostic should be performed along with treatment of the oral hematoma? Ear swabs should be collected for cytologic evaluation and to determine whether ear mites, Otodectes cenotus, may be a complicating factor. Oral hematomas are almost always caused by uncontrolled otitis externa. Ear mites would be a likely diagnosis in an indoor-outdoor cat. However, other options may be considered, such as secondary infections with bacteria and/or yeast, underlying allergic disease, or concurrent external parasite infestation, for example, dab fleas, notoedres mites. Several surgical corrections are available for oral hematomas. Describe them. Surgical techniques involve incising over the hematoma cavity, draining excess hemorrhage, and placing full-thickness sutures at regular intervals to keep tissue layers opposed. This tends to provide the most cosmetic repair. Alternatively, a cannula may be placed in the hematoma cavity to provide drainage. Suction drains may provide similar benefits. The cannula or drain is typically left in place for several days until drainage stops. Punch biopsy technique involves making multiple drainage holes in the pinna. The biopsy sites should be left open to heal by second intention. A CO2 laser may be used in a similar fashion to punch biopsy. Tissue adherence may be improved when the laser is used. The owners have moderate financial concerns, and surgery is not an option for the cat. What alternative options may be considered? Medical treatment for oral hematomas is successful for many patients. The hematoma should be drained as much as possible. Both medial and lateral compartments of the pinna may be affected. And then a small amount, approximately 0.1 milliliters, of long-acting injectable steroid, for example, triamcinolone acetonide, can be injected into each compartment. Bandaging may not be necessary or effective. Additionally, it is imperative to treat the inciting cause of otitis externa and any secondary infections that led to hematoma formation.